Good morning. After many months of envisioning and planning this day, it is indeed my pleasure to welcome you to the second annual Greenleaf Public Policy Lecture, a signature program of the Greenleaf Center for Servant Leadership here on the campus of Seton Hall University. I'm Reggie Lewis, the Executive Director of the Greenleaf Center, and I'm thrilled to greet all of you from across the country and abroad who've logged on this morning to take part in this historic moment for the center. This includes Agnes Mucha and 4 other friends from the United States International University of Nairobi, Kenya. Welcome. The vision of the Greenleaf Public Policy Lecture is to create a viable opportunity to assess societal challenges through the lens of our namesake, Robert Greenleaf, who not only coined the phrase servant leader, a concept in which the leader first seeks to serve, but more profoundly envision a more just and caring society through more responsible individuals and institutions acting as servants. In his credo of 1980, Greenleaf states, if a better society is to be built, one more just and caring, and providing opportunity for people to grow, the most open course, the most effective and economical way, while supportive of the social order, is to raise the performance as servant of as many institutions as possible by new, voluntary, regenerative forces initiated within them by committed individuals, servants. Thus, our theme for today's lecture, advancing equitable policies during a pandemic. Arguably, our gathering today is timely in light of so many reminders and ways in which this society remains far from just. This is why the center is so fortunate to have the presence of Dr. Torian Easterling, one of the nation's foremost thinkers in the healthcare sector, here to offer us insights on how we might incorporate tools, strategies, and an enlightened perspective for serving those most left out in the public policy domain. In a few minutes, a very special guest will formally introduce our distinguished lecturer and moderator. But before we proceed any further, I would be remiss in failing to acknowledge the kindness and generosity of our sponsors. Hackensack Meridian School of Medicine, thank you so much to all of our friends at Hackensack Meridian. We're also fortunate that an anonymous donor provided the center with an opportunity to pay homage to the life of Dr. Frank Jones in the wake of his recent passing. Among his many accomplishments include the appointment as the Ford Professor of Urban Affairs and subsequently being named the first African-American to achieve tenure at MIT. Dr. Jones spent his career focused on issues of race, poverty, and inequality. As a strong proponent of Robert Greenleaf and servant leadership, he single-handedly touched and influenced the careers of hundreds of young men and women across the country, including yours truly. Thank you, Dr. Frank Jones. It gives me great pleasure to now introduce Dr. Chris Pernell. Dr. Pernell is a dynamic physician leader and social change agent. Her public health practice focuses on health justice, community-based advocacy, and public-wide, or I should say, population-wide health promotion and disease prevention. And as we affectionately refer to her in the community, welcome, Dr. Chris.
Thank you so much, Director Lewis. Good morning to everyone, and it is my esteemed pleasure to be with you today as we have 2 very distinguished thought leaders in the public health and healthcare and health education landscapes. First, I'm going to start off introducing the lecturer for today, who is a dear friend, colleague, and co-collaborator across the health justice and racial justice landscapes. So Dr. Torian Easterling is a family medicine and public health physician who recently served as the first Deputy Commissioner and Chief Equity Officer at the New York City Department of Health and Mental Hygiene. Dr. Easterling served as the first ever Chief Equity Officer for one of the largest public health agencies. As first Deputy Commissioner and Chief Equity Officer, he led the city's equity response for the COVID-19 pandemic. He also led implementation of anti-racist public health practices, including the agency's internal Race to Justice program, and oversaw the health department's Take Care New York initiative, which centers community collaboration to reimagine neighborhood health. So let us all welcome Dr. Easterling. And next, we have our moderator for today, the equally esteemed Dr. Marie Foley, who is Dean and Professor of the Seton Hall University College of Nursing. Dean Foley's research interests include topics in school nursing, mentoring students and new faculty, tool development, child temperament, ADHD, and parenting. She's published articles on delegation in the school setting, family adversity, and parenting of children with ADHD and auditory processing disorders. She likewise has presented at international, national, and regional research conferences on the related topics. Of note, she's won several prestigious awards, including the National Association of School Nurses Outstanding School Nurse Educator in 2013 and the Journal for Specialists in Pediatric Nursing Research Article Award for 2011 and 2012. Again, let's give a heartfelt and robust welcome to both our lecturer and the moderator for today's lecture. Thank you. And now we'll turn it over to Dr. Easterling.
Thank you. Thank you so much, Dr. Chris. So sorry for that delay in unmuting. This is such a norm in this virtual space, but I am just so happy to be with everyone this morning. Thank you to Dr. Foley for your executive leadership at the institution. To Reggie Lewis for your leadership at the Robert K. Greenleaf Public Policy Center, and Priscilla and all in your team as well. And certainly to my friend, Dr. Chris Pernell, who I have known for more than a decade and has been steeped in this work, particularly around advancing an equity agenda. It is my distinct pleasure to be joining you all this morning, serving as the second annual lecturer for the Robert K. Greenleaf Public Policy session. This is an honor, and I am a Jersey boy, just only 5 minutes away from Seton Hall. I grew up and spent all of my time, so I am deeply grateful to be with you all today. I have a few remarks that I want to try to do before we get into questions, and I'm going to bring up my screen, my slides shortly. All right, so we'll jump on in. I have no disclaimers to report. I am here solely as a representative, not only of the health department, but certainly the 8 million people who this agency continues to serve on a daily basis. I'm starting here with this preamble, and as we go forward, I think you'll understand why. But the preamble reads, whereas the work of undoing racism is grounded in love, as well as science and civic duty. This love is not sentimental. Rather, it is what James Baldwin called the tough and universal sense of quest and daring and growth. Now, this is an excerpt, part of the preamble of the recently unanimously passed resolution by the New York City Board of Health declaring racism as a public health crisis. This whereas statement closes the preamble, and we thought it was really important because love is something that we do not talk about in this work. And as we describe here and allude, this is not the personal intimacy love. This is the love that we all we all aspire for, to be in spaces where we feel safe, where we feel valued, and where we feel seen. Every living person deserves that. And this is why this work is so important. And so, part of my task today in talking about servant leaders, and I'm certainly grateful again for the invitation, because it allowed me to understand the work of Robert Greenleaf, the work of the center, but also to understand, because I've heard this term before about servant leader, and it is certainly the work that I have done. Part of the reason why I am where I am is certainly because of the people that have touched me and the experiences that I have had, and really trying to seek ways in which I can use my skills to ensure that those who have been most marginalized, who have been discriminated, that have felt the brunt of oppression, that they do feel valued and they feel seen. And it is certainly something that has been instilled in me from a very young age. But I'm also grateful for the many mentors, the many people who have touched my lives, the institutions that have poured into me, from Morehouse College to UMD&J, now Rutgers, New Jersey Medical School. I have spent years doing work both locally and abroad. In Haiti, as you see in the upper left-hand corner, as well as in Liberia, and really understanding that my skill sets should not be just shared here in our home country, because the same struggles that we are experiencing, not just in housing crisis, not just in dealing with poverty, but this idea of feeling seen and feeling valued, and making sure that people understand that there is so much more that they deserve, and that's part of the mission that I've had. And certainly medicine has allowed me to be in those spaces. And this picture, I think, helps put it into perspective. This is a famous photo by photographer James Corral that was taken in 1965 from the march to Montgomery from Selma. But this photo is also the cover photo for a well-known documentary, Eyes on the Prize. In the mid-90s, it would be very hard for you not to have watched this, because this played on PBS for every holiday during Black History Month, certainly on Dr. King's Day. My mother was very clear. On King's Day, it was service day. If we're not doing service, we're sitting down in front of PBS 13 and we're watching Eyes on the Prize. And I think this is my earliest recollection of servant leaders, on a quest, on a mission, commitment, really putting yourself on the line, knowing where you're coming from, but don't know what's ahead. And certainly the folks in this photo didn't know all of the danger that lies ahead, and there was certainly danger, but they were committed. And they were committed because they wanted and knew that there was a better society that needed to be achieved, not only for themselves, but for all mankind and womankind. And I think that's part of what the work that we've been doing in New York City, and certainly that has been driving my work as well. I think I certainly think about all the different episodes and the people who gave their lives for a better society. Certainly Dr. King, who I think, again, an early example of a servant leader, talks about the beloved community, and also my Morehouse brother, because I think it's really about how are we making our society better? How are we using our skill sets? How are we using our expertise to ensure that every living person has the opportunity for a better life? And I think that is certainly what you're going to hear, part of the work that I was leading in New York City, as part of so many others who continue to lead this work as well. So when we sort of think about what lies ahead, we certainly did not know in 2020 what lied ahead with COVID-19, a new virus. And as you see here, this graph, this epigraph is showing us the number of cases, particularly in New York City. And you certainly see, that there were more cases that the people infected in January 2022 compared to those in 2020. But what's really startling is the deaths, the number of people who have died due to COVID-19. And this really drove the work that we needed to do. How do we minimize suffering and how do we save lives? How do we minimize suffering and how do we save lives? But there was always another conversation to be had, because certainly these two slides do not tell the whole story. Because what we do know is that there has never been the right type of investment that has helped close the gap between white Americans and Black Americans, giving the long history of racial discrimination, giving the long history of Reconstruction and Jim Crow laws, and what has been done to Black and Brown communities. We already knew that there were inequities that existed long before COVID. When we look at the unemployment rate, when we look at home ownership rate, even when we look at life expectancy at birth, there are all these gaps that exist. And without the right type of investment, without someone paying attention to these persistent gaps, then what we do is we have universal policy approaches that only really protect those who are well-resourced, who are well-employed, to really take shelter during times of emergencies. And certainly COVID-19 pandemic, global pandemic, a public health emergency showed that as well. Particularly those who are essential workers, who are forced to go out and continue their work and could not work virtually. If they could not afford a caregiver, could not afford someone to come and be with their children, juggling all of these things, as well as other crises that we knew existed at that time. That's the conversation. So how do we save lives? How do we minimize suffering? And how do we do all of that with equity at the forefront of every conversation that we're having, not just around practices and policies, but certainly around the people as well. Now, this graph, I think, helped us articulate a little bit better. Here you're seeing COVID-19 hospitalization rate in New York City during the Omicron wave. Going back to 2020, we saw that Black and Hispanics certainly continued to have the highest rates of hospitalizations as well as deaths, cases in the early parts of the pandemic. But what was also clear was that disparity continued. Excuse me. That disparity, that gap continued throughout the pandemic, as you see in the red line there, as well as the gold line for Hispanic New Yorkers, high rates of hospitalization. And so the conversation needed to be had. There was a lot of work that we can do around increasing access to vaccines. There was a lot of work that we needed to do to increase access to life-saving treatment. But what we also needed to pay attention to the root causes of why we were seeing higher rates of diabetes and hypertension, heart disease, that was leading to more severe outcomes due to COVID, particularly during this global pandemic. And I think we have to have a conversation, a total conversation, about what those root causes are, what are the likely outcomes, because those root causes do exist, and how is this going to play out during a public health emergency. So all in all, there was a charge, so to speak, for all of us, and that charge wasn't set in 2020. That charge wasn't set during the beginning of the pandemic. I'm happy to say that our agency had already set in motion work to undo and dismantle racism, white supremacy, particularly in our own agency, and making sure that we were working towards making New York City a more equitable city. And so here you see a quote from then Commissioner for New York City Health Department, Dr. Bassett, who is now the New York State Health Commissioner, now serves for Governor Hochul. At that time in 2014, in response to the ruling of Daniel Pantaleo in the charge for the murder of Eric Garner. At that time, Daniel Pantaleo was not going to be charged with murder, was not going to lose his job, was not going to lose his pension. And it was certainly an uproar. And folks will remember the hashtag Black Lives Matter, students in white coats really, pouring out in their support to raise the consciousness around injustice and injustice. And so Dr. Bassett plainly stated that inequities in health are unfair, unnecessary, and avoidable. And there's so much more that we must do. And as she was talking to we, she was specifically speaking to medical and public health communities. But as we have continued on beyond 2014, dealing with the murders of George Floyd, Ahmaud Arbery, Breonna Taylor, so many others, that charge was for everyone. That charge was to say, where will you draw the line in the sand? And how will you be clear about dismantling these inequities and addressing them to ensure a better society for all? And so in 2014, we put in motion to do both internal work as well as external work. Internally, how we were normalizing conversations around race and racism, how we began to organize ourselves within our agency. Organizing ourselves meaning making sure that all of our work we embedded an equity lens, and how were we going to hold ourselves accountable and operationalize it, meaning looking at performance metrics and making sure that those outcomes really aligned with the work that we needed to do. But this framing, going back to normalizing, I think is so important. And I think that this applies to all of our work, whether you're in academia, whether you're in business, whether you're in the private sector, because the conversation that needs to be had isn't the downstream conversation. As I started off on this talk, I talked to you about disease and injury and mortality. We knew the numbers of, well, maybe not so much early on, but as we began to build our infrastructure and resources, we were able to do more testing all throughout the city, all throughout the state. We were able to understand who was dying from COVID-19. But the questions that we needed to ask more was about the upstream issues. How are we seeing differences by geography? How are we seeing differences by race and ethnicity, by immigration status, by class and economic work? What institutions, what role do they play in ensuring that they can help close the gap? What resources can they leverage? What laws and policies do we need to put in place so we can close the gap? So that the mortality conversation isn't just about the total number, but making sure that those who are most burdened, we're addressing their needs first and foremost. And so this framing, I think, is really important by the Bay Area Regional Health Initiative. This public health framework, I think, is really important, and I think it is something that is germane to all the work, is how do we have an upstream conversation? And I think there have been so many people who have articulated this idea of upstream work, from Bishop Desmond Tutu to Dr. Kamara Jones as well. So part of our analysis was making sure that we were standing on good principles. And so here are 6 anti-racism public health practices within the New York City Health Department How are we directing tailored and prioritized investments? How do we use data for equity? Meaning that we are contextualizing inequities and we are using our analysis to show differences, not only by race and ethnicity, but making sure that we can disaggregate the data to share as much information as possible. Part of this work, and I know and I know this to be very true. Part of the work of equity is about changing the narrative. It's about singing a different song. And I think that was so germane to so many movements that we have seen in the historically as well as in contemporary. So changing the narrative is so important in the work that we do. As I talked about, embedding equity in all the policies that we're putting out. Certainly making sure that we're creating an equitable workplace and looking at all of our entire workforce and ensuring that we are supporting everyone top to bottom. And then I think really important to everything that we do is creating and establishing transparent and accountable partnerships. When we think about a public health infrastructure, the public health department is only one partner in this total universe. Our healthcare system plays a huge part. Our academic institutions play a huge part, but our community-based organizations are really the critical safety net in all the work that we do. Our faith-based organizations as well, our banks. And so all of these sectors play a huge role. And we saw that during the pandemic, making sure that we were delivering information, delivering policies to help inform their workforce, but also to understand how they can play a role in ensuring that they were creating a safer environment for all. So we created this position. Dr. Dave Chokshi, a dear friend and colleague who I had the honor of serving under as he served as the 43rd Commissioner of Health for New York City, had asked me to step in as the first Deputy Commissioner and Chief Equity Officer. The idea that we could be intentional about achieving equitable health outcomes. So the second in command, it also serves as a Chief Equity Officer, making sure that our institution is looking at how we are aligning our work internally and ensuring that our equity goals are clearly laid out, but also externally as well. And so how are we communicating what our measurements and our goals are? What are the systems and structures that we need to put in place externally and the relationships to help us move that mission forward? And it was certainly an honor. And now Dave and I are no longer with the health department, but so happy to know that this work continues, not only in the people who remains, but also in the structure that we establish as well. This is one example, just some of the work that we've been able to do, particularly during COVID, a hyperlocal approach in response to COVID-19, and this was something that was written up. You'll see the paper description at the bottom there, the community assessment to inform rapid response. We built a community model, and this was really all driven in conversation with community organizations who just clearly stated that they did not have enough resources to really engage individuals and families to let them know how they needed to be safe. This work started in May of 2020. And part of what we really wanted to do was to ensure that we could activate trusted messengers, trusted community partners to really reach the places that we couldn't reach, to get our messaging, to ensure that they had the resources like face covering, as well as providing rapid testing. And at that time, in April of 2020, testing was certainly hard to come by. And so we set up testing locations, particularly in neighborhoods where we were seeing the highest COVID-19 infection rates, where we were seeing the highest number of deaths. And to no surprise, those same neighborhoods were Black and Brown communities. And so most of these pictures are in Brownsville, Brooklyn, Tremont, and the Bronx, as well as in Southeast Queens. One of the things that was really, really important for us was really delivering clear information about where we were seeing high rates of infection and what individuals needed to do. This press release for our Vaccine for All campaign, as part of the de Blasio administration, what was really important was also making sure that we were using our data, not just disaggregating by race and ethnicity, but really what you see here are 33 neighborhoods. We were able to establish a methodology that allowed us to really pinpoint what were the neighborhoods that are who are most at burden due to COVID-19, due to COVID-19 cases that were due to COVID-19 deaths and hospitalization. And what we were able to do was also look at additional factors. So where are we seeing neighborhoods that had high numbers of individuals who were in central roles, who were our cab drivers, who operated and owned supermarket stores or corner stores, these individuals who were in essential roles and they could not work virtually. We also looked at neighborhoods where we saw high rates of overcrowding, housing, or where you had multi-generational homes. Those are the neighborhoods where we needed to pay attention closely. We needed to drive most of our resources to. And so you'll see here in Northern Shore of Staten Island, you see here in Harlem, East and Central Harlem, the South Bronx, North and Central Brooklyn, like Bedford-Stuyvesant and Brownsville, Southeast Queens, like at Jamaica and Richmond Hill. Those are the places where we needed to really drive our resources. And so part of my work as the Chief Equity Officer for the Health Department was articulating to our principal, then the former mayor, Mayor Bill de Blasio, to say, here are the neighborhoods. How can we ensure that there will be enough resources carved out and really focused in these neighborhoods? We can still do a universal approach. We can have testing vans and vaccine vans here and there all throughout the city, but we need to ensure that there are additional resources, additional vans, additional outreach, particularly in those neighborhoods. And that's what we were able to accomplish under the former administration. And particularly because what we were able to do was really establish a whole of government approach. This wasn't just the health department. This wasn't just our healthcare system. We had to activate the entire city administration. And thanks to the leadership of the former mayor and the former first lady, Shirlane McCray, and so many others, we established our task force for racial inclusion and equity. And so what we did was we asked all of the leaders of color across all of the different agencies, so housing, education, social services, city planning, New York City Housing Authority, all leaders of color to come together and really think about the policies, to think about how we can activate their staff, their workforce to really drive through what we needed to get done, particularly during this pandemic. And it wasn't just about vaccines, it wasn't just about testing, it was really trying to get more upstream. As you see here in the lower left-hand corner, we formed the Pay Equity Cabinet, particularly to fight disparities that we were seeing in wages, because we knew that part of the conversation was how are we building generational wealth? How are we closing the wealth gap to ensure that individuals can make choices about how they need to operate during a public health emergency? Quite often and quite frankly, we know that most white communities can have those conversations about how they shelter, about how they can move differently, how they can leave the city. And that's what we saw, particularly in Manhattan. Many families left the city, where others, because of the resources and the limitations, are not able to leave. And so how are we building economic wealth for all families to be able to have those conversations? We've already talked about having an equity plan related to our vaccine efforts. And then not just most recently, but also at that time, establishing the Racial Justice Commission, particularly internally looking at how the city operated, our own city charter, in our own policies that govern the way that the city operated. Then so the Racial Justice Commission, which was led by Jennifer Jones Alston, whom many may know is a co-host on Open Line on Sunday mornings, was the chair of our Racial Justice Commission. I had the unique pleasure of not only reporting to the commission, but also testifying to the commission about some of the policies we were able to implement during the pandemic, and also propose amendments that could be placed in the city's charter. And so just recently, this past general election, New York City voters did vote to amend the charter in 3 different ways. And so all 3 of the amendments, not unanimously, but they passed, and they received overwhelming support by New York City voters. And I think that this is the way in which we can use our voice to enact our civic duty to really ensure that we are creating a more just and inclusive society. A vaccine equity strategy, one of the things that was really important for us was how we were communicating our work. And so during the rollout of our vaccine campaign, I co-authored a vaccine equity strategy that really talked about what we needed to do to not only increase access to vaccines, but also ensure uptake. We certainly know that just because we build it, people are not going to come. And so how are you ensuring access, ensuring uptake, making sure that you reach the outcomes? And again, part of that approach has to be dismantling systems of oppression. And so you see here in the opening line of that equity strategy is that we knew that this required unprecedented collaboration, and that we all had to have a clear understanding that this approach is really about addressing racism and other systems of oppression, and not just limited to racial injustice, as I said, but also looking at all systems, gender bias, understanding religion bias, and all these other systems that we know are at an intersection when it comes to racial injustice. Thinking about the work that we've done in our COVID-19 policies, minimize suffering and saving lives, this is just a list of just some of the policies that we, as it came to thinking about what our approach will be, the conversations that we need to have around equity, and certainly thinking about vaccine mandates, thinking about where we place our vaccine sites, testing, how we were keeping schools open, keeping them open, primarily because we knew that they were an anchor site, particularly for families across New York City. Meaning that if we close our schools, then what will families have, particularly those who are essential workers who did not have another option, who did not have the resource to leave the city. And so our schools were always first to open and last to close. That was a clear mantra within the conversation with our principals. And so how are we making sure that we can use all the resources to all of our other approaches to keep people safe, to save lives, and close the gap? And quite frankly, I think that we were successful in so many ways. As you see here, I think very clearly, as we saw that vaccinations increased, we saw hospitalizations decrease. And this wasn't just to show the power and the benefits of vaccines, but this was also really to make clear why our equity approach was so important. As I showed earlier, hospitalization rates were highest among Black and Brown New Yorkers. And so we needed to ensure that we were really driving forward our vaccine equity strategy if we were going to drive down hospitalization rates, particularly in Black and Brown communities. And so the policies that I just alluded to earlier became really important. And here you see sort of our vaccine coverage and in relationship to some of the milestones that we were able to reach with some of the policies, making sure that as we were able to implement, vaccine policies such as mandates for restaurants or mandates for employees, workers, that we were able to achieve higher numbers. And certainly this became super important for our vaccine efforts. Here you'll see, certainly in the beginning, our citywide rates were much higher. But when we started to disaggregate the data, we saw that the numbers were lower for Black and Brown communities and for communities that have been hardest hit. But as we continue to push forward with our policies, we continue to push forward with our investments. And so we put funding into community-based organizations. We put funding into community-based providers, so federally qualified health centers and safety net hospitals, to really do outreach and engagement with individuals. Really important that we saw over time that we were able to achieve higher rates in New York City housing authorities, essentially our public housing in New York City. And we've also saw that we were able to close the gap between our citywide rates and the neighborhoods that were hardest hit. And I think this is really important, because if we do not continue to track how those gaps persist, then how are you going to correct them? And so these are just prime examples of the work that we have to do in these type of discussions to continue to call out the work of achieving equity. And if no one is lifting it up, then it's not going to be done. And so we always have to think about what's our role in spaces like that, particularly when there's investments and urgency. But urgency cannot come at a price for equity. And I think that's really important. And that really stuck with me throughout my time. So I'm going to wrap up because I know that we have to end really soon. But I just want to end here to just talk about sort of where we go from here. As you heard, sort of the work that I was doing was not only achieving equity through our vaccine campaign, but also internally, so leading our race to justice efforts. And one of the proudest moments was the unanimous passage of our Board of Health resolution, because part of the work is ensuring that we have the right type of leaders, is investing in program, but we must ensure that there is an accountability mechanism. And so this resolution requires the Department of Health to make sure they follow through on 9 commitments. Now it doesn't have to stay 9, but we started with these 9, making sure that we always continue to research, clarify, and acknowledge examples of how underinvesting and divesting has led to harm in Black and Brown communities. Ensure that the work of Data for Equity is always an approach that we will use, not only for the health department, but also for the city. Making recommendations on how we can continue to look at addressing race practice of addressing systems of oppression within the city charter as well. Really also addressing the ways in which we use our data to talk about demographics, race and gender, and other health conditions to improve care in other sister agencies as well. These are just all examples of ways in which we have ensured that this health department, one of the largest health departments, will continue to advance this work. And so with that, I will close here. Again, I think just lifting up the fact that it is time for us to draw a line in the sand. I think it's all for all of us policymakers and public health professionals, figure out what is our work of advancing equity. And I think that this is something that even as whether we see ourselves as servant leaders or not, I think this is something that we're all called to do. Thank you.
Thank you, Dr. Easterling. This certainly was a compelling lecture on the importance of addressing the social determinants of health and inequities related to racism, equity, and inclusion in health, healthcare, and policy, especially during the pandemic. You truly are a role model, not only for love, but also for servant leadership. So we do have a few questions that we would love for you to answer. The first one, you have an extensive experience in equity and inclusion policy making in the healthcare sector. How did your experience prepare you to take on the role as New York City's first Chief Equity Officer?
Thank you, Dr. Foley. And thank you for the question. I would say the best leadership advice that I received is always be prepared for the next challenge. And certainly there are a lot of things that I would say I was unprepared for. Serving as the first deputy commissioner and the inaugural chief equity officer during a global pandemic. Certainly those are these things that you just cannot account for. But I think the best way to be prepared is always to think about how you can join in solidarity. That means that we have to understand what are the issues at hand? What are folks dealing with? What are the crises that we need to address? And I think joining in solidarity with others is really important. And so then the next step is that once you know what others are fighting for, what those crises are, how you're going to join in solidarity, I think the question is, in that role, how are you going to resolve systems, resolve the practices that continue to perpetuate those inequities?
Thank you. That's so true. The second one is, not everyone in the medical profession embraces servant leadership. Why do you think servant leadership is essential to providing quality care to others?
Yeah, servant leadership is really important because it puts the emphasis on individuals and communities, particularly those who are experiencing injustice. People want to ensure that whatever space that they're entering, that their language, that their desires are going to be accounted for. They want to be seen. They want to feel valued. And I think particularly for those who are in patient care, the Hippocratic Oath, it states that we first do no harm. But the first line in that text, it says that I swear by Hippocrates, by Asclepius, and some other Greek god, that I'm going to do these things. And so if we're truly going to be servants, then we have to ensure that there is some accountability mechanism to ourselves and what we're going to do in taking care of the people who are in front of us.
Right, exactly. I think that pertains to all healthcare professionals, as you said. How might policymakers design greater incentives to push public health professionals to prioritize racial and gender inequities?
Yeah, no, very, very good question. I think this is where we have to make this the standard practice. We do not want to leave this up to chance. We do not want to leave this up to the next mayor or the next governor or the next president. We want to make sure that this is built into the way that we do our normal business. And I think that some of the examples that I laid out at the end there, one, looking at the city charter, or looking at if you can pass a resolution that ensures that there is a commitment and it holds agencies or counties accountable for that type of work. And I think that what we're also seeing in so many cities is this whole of government approach. Certainly, we're seeing it in Newark, New Jersey with Mayor Baraka, New York City, as I talked about, with the recent establishment of our Office of Equity. We now have a commissioner who leads the citywide equity approach. We see this in Philadelphia, and we see it also in other jurisdictions. And I think that the question is, how do we hold our elected officials accountable to ensure that these are things that they understand are the priority? And I think that's important. And just to go back, Eddie Glaude in 2021 talks about that this country is standing at a knife's edge. And so essentially, we know that there are so many crises that are happening right now, not just abroad, but here in this country. And so, the clarion call has already been put out there. We want change. We want a more inclusive, we want a more just society. And so really, it's upon the policymakers to say, how are they going to respond to the call that so many citizens have been asking for?
Yeah, I think it's so important. I mean, not just to talk the talk, but like you said, to walk the walk. So thank you. Not all cities have similar budgets and resources comparable to New York City's. So in what ways do you think smaller municipalities and jurisdictions invest to operationalize and address long-standing inequities in healthcare?
Yeah, now this is a really important question because there is so much that we can do without funding or little funding. Certainly, the passage of a resolution requires no funding at all. It requires clear vision, leadership, and a commitment to move it forward. And in articulating a shared vision and analysis to ensure that others understand why that resolution is so important. How are we going to achieve the milestones that we're setting forth in the resolution, and what resources are needed, which is not always funding. It's looking at the existing investments you've already made. Most jurisdictions are already looking at data, right? They've already established task force that are setting recommendations. But how are we using those resources in a way and applying an equity lens? I think that is the real question. We are seeing in healthcare that there have been steps towards hiring more diverse leaders. And certainly, we're joined by Dr. Chris Pernell, who has been a renowned leader in the healthcare system, particularly around equity and systems change. And I think what we're asking for is from healthcare systems is not only to make that commitment in hiring, but also the follow through, the commitment and also investing in those type of actions and making sure that that work is well resourced. We don't just need one person to hold the title. We need that person and their entire team to move the work forward. And so how do healthcare systems think about not only articulating equity, as you were just saying, but then also carrying that through in their patient delivery. So thinking about patient delivery within the four walls, but also their commitment to the community that they also serve as well.
Exactly. Thank you. Our last one is, what should factor into key lessons learned from the pandemic? How might we use this trying period as a catalyst to improve health outcomes for all Americans, especially among the most vulnerable?
Yeah, I have three quick ones. No surprise, we have to reinvest in public health. Most people do not even think about public health until they need public health. And certainly public health has been thrusted into the spotlight because of this pandemic that we're recovering from. And so we have to reinvest in public health. We have to think about the ways in which we are using our data differently, that we're ensuring that everyone has access to life-saving, not only medications, but treatment. And I think that's number one. We have to continue to find ways that we diversify leadership. And so not only in titles, but also from top to bottom. And thirdly, we have to think about how we invest in our safety net hospitals. A majority of the safety net hospitals, so you think about a Beth Israel, a University Hospital in Newark, New Jersey, or you think about Brooklyn, One Brooklyn Health, SUNY Downstate. These are the hospitals where majority of their patients, 95% of their patients are Black and brown. But quite often, these are the hospitals that are most underinvested. They often do not have an elaborate customer service experience. They do not have an elaborate electronic health record. How are we investing in these institutions that are caring for those who have been most marginalized? And I think that those are just some of the clear examples that we certainly have to follow through on as we recover from this pandemic.
Great, thank you. I think we have a little bit more time, so we have a couple of questions from the audience. The first one says, this is from Rich DeVries. First of all, kudos to you and your team, Dr. Easterling, for the comprehensive identification, planning, and activation of your efforts. My question is, have these programs impacted other cities across the nation?
Sorry. Yes, these programs have certainly impacted other cities, and also part of our work is also having solidarity with our international partners as well, because we also put out a global call to action to ensure that there were vaccines for other countries, particularly in the continent of Africa, in India, because we certainly saw that vaccine coverage remains low on both of those places. So I think it's certainly making sure that we're taking care of our borders first, but then it's making sure that we're also linking up in arms and struggles with other jurisdictions and other countries. One example around some of the state leadership or interstate leadership, I would say, is the work that we have been doing between New York, New Jersey, and Pennsylvania. And so certainly, at the height of the pandemic, there was a lot of collaboration between all three states in thinking about the policies that we put in place, because we knew that there was a lot of travel between all three of these states. And so thinking about vaccine efforts, and so if someone was to go over to New Jersey to get their vaccine, we were able to get that data really quickly. We were able to assess, are they in neighborhoods that have been hardest hit? And so these are just some of the policies that I talked about that would also be enacted in other places.
That's great. Thank you. The second one is from Joseph Patronak, another one of the board members for Greenleaf. And he says, I was fortunate to work at the Cleveland Clinic for 7 years. We recognize the important role of local community hospitals and their impact on ongoing health, especially during COVID. However, most are challenged to stay open. Was there a part of your plan to help keep them open via the city or state funding?
Joseph, thank you. Thank you so much for the question. And yes, absolutely. There was so much, there were a lot of missteps. And I think we have to continue to be honest about what those missteps were. And I think we're going to have to talk more about how city and state fumbled the ball. Certainly we saw very publicly, between the two principals, city and state at that time, there was just no collaboration at all until Governor Hochul stepped in. And certainly we saw that our community hospitals were severely affected. Not only our hospitals, but our academic institutions, particularly our state institutions, were severely affected by a lot of that tension at the city and state level. But some of the funding that we did very early on, we were delivering PPE to all of our community-based providers, our federally qualified health centers, our community centers, making sure that our healthcare workers were taken care of and they had testing resources as well. Over time, we started to look at other resources as well. One of the things that we were able to do, get loan funding. It was a loan, but initially that loan, we did not ask the safety net hospitals to repay that first loan. Essentially, we were using the loan to ensure that they can buy any equipment that they needed for during the pandemic. And so there were just certain initiatives that we were able to roll out to make sure that we were able to funnel funding to our community hospitals.
Great, thank you. I'm going to give you this one. Was there a specific instance in your life that inspired you to learn and practice servant leadership?
That's a good question. I have to think long and hard about a specific instance. But there are so many. I think it just continues to go back to the examples of people that I saw and people that continue to pour into me. One person in particular, Lonnie Wright, who is well known in New Jersey. He served as the Associate Dean of Multicultural Affairs at New Jersey Medical School, was really instrumental in me getting into that institution, and would always talk about the importance of telling your story and making sure that those who do not know you, have not seen Black doctors, that they know the journey, because we have to continue to keep the door open. And he could have gone on to do so many different things. He was a two-sport athlete, professional sports. He played for the Denver Broncos and then the Denver Nuggets before they were called the Denver Nuggets. But he came back and he poured back into his community that raised him, and that was so powerful to me as a young medical student, and then making sure that I continue to serve others and continue to do the work that I was doing.
Thank you. Do we have time for maybe one or two more, do you think?
We do.
Okay, great. So from Layla White, does stratification play into the lack of resources?
So absolutely, stratification does play into lack of resources. I would say that we understood for New York City that we are well-resourced. And so we could not talk too much about lack of resources because we knew that other jurisdictions, other states had it tougher. But what we tried to do, given that there was lack of resources, whether it was around vaccines or testing, there were limited supplies. We certainly had to think about what was the best way that we were delivering life-saving resources to individuals. And I think that part of this, I think part of what we learned is that we do have to be bold sometimes. We have to have tough conversations, but we also have to have conversations with community, help people understand, give them, some of our thinking, but also do it in collaboration. Now that always doesn't happen. And again, you have to move with urgency, but to the best of our ability, there are opportunities where you can have conversations with community and be able to and help individuals understand if there are a lack of resources, how do you best deliver those resources? And we certainly tried to do that. There were plenty of times that we surveyed New Yorkers, that we engaged community-based organizations to better understand how we can deliver resources.
Great. And the last one is, hello, Dr. Easterling. How can we as individuals articulate and make healthcare equity actionable on a grassroots level?
Yeah, thanks so much, Jay, for the question. I think articulating it is first just naming it. I think we have to start with naming it. I do not want to take for granted that everyone still understands that there is a need for us to talk about racial and social injustice that still exists in this country, and that the original sin of this country has pervaded this society for a very long time, and particularly has been a stain on the way in which we conduct and treat people and value individuals in human life. And so I think we have to name it. We have to continue to talk about it, and we cannot be tired of it because lives are at stake, and we know that. And we see it on a daily basis. And so starting there, and I think that having that conversation and then understanding steps and work that can be done, even at a grassroots level. I think part of it is understanding that there are organizations that are already doing this work. And so at a grassroots level, linking up and again, joining in solidarity with those organizations and understanding what the approach is. And so I think true collaboration is necessary. We're not going to achieve the mission alone. We really have to think about what collaboration looks like. There are lots of ways that we talk about what equity is, and it really isn't. Equity isn't about just making sure that we are doing community outreach and we're doing education. We're talking about true systems change. We're talking about dismantling the way in which we live our normal lives. We're talking about the easiest choice just being the natural choice. The easiest choice cannot be the only choice we go with, because we understand that those outcomes do not favor all people in this society. So I do think it is important for us to have this very tough conversation about what are those systems and practice that continue to persist injustices for communities, for individuals who have experienced longstanding discrimination. And so that's why I think normalizing that conversation is really, really important.
Oh, most definitely. Yeah, so that was all of the questions. And unless did someone else? Oh, wait, here's one other. Oh, this is probably an easy one for you. What inspired you to pursue a career in the healthcare sector?
From a very young age, I wanted to become a physician, and there was no sort of like flashpoint moment. But I think what was really important was that I had a mother who was very supportive from a very young age, who never stated that, oh, that's going to be challenging. Was just really, really supportive and really exposed me to just continue to go after that dream. And I think that that's just really important, because while there are naysayers, I think it's always identifying who are your champions. And there's certainly going to come champions going to be inside your home and outside of your home. And I'm thankful for all of the champions who have touched me along my journey.
And I think I can speak for everyone when I say we're also very grateful to your mother for encouraging you and making sure you pursued your dream.
I will tell her that.
Yeah.
So
thank you very much. This was really a wonderful and inspiring talk, and we are delighted that you were able to come and join us and more or less welcome home.
Thank you.
Thank you, Dr. Easterling, Dr. Foley, and Dr. Pernell, and of course to all our guests for joining us today. A recording of this lecture will be available later this week in case anyone wants to rewatch. I know I'll be doing that, as well as share it with those who were not able to attend today. And we also hope that everyone continues to stay connected with the Greenleaf Center through our 5 core programs. Through our programming, we promote the philosophy of servant leadership, a philosophy in which the leader first seeks to serve. These programs include the Greenleaf Academy, which creates an online learning opportunities for professionals across a variety of sectors. The Greenleaf Scholars Program, which provides small grants to support scholars doing research on the value and efficacy of servant leadership. The Coffee with Webinar series, which provides an opportunity to showcase the inspirational stories of servant leader practitioners. The Next Generation Initiative, which allows the center to introduce servant leadership to local high school and college students. And finally, today's annual Robert K. Greenleaf Public Policy Lecture, designed to be an ongoing conversation among thought leaders committed to a more equitable society. And you can learn more about all these programs by visiting greenleaf.org. And you don't want to miss out on an upcoming servant leadership opportunity. We still have spaces open for our Academy course, Key Practices of Servant Leadership. You can register on our website and find more details. Once again, thank you, Dr. Easterling, for your lecture. Thank you, Dr. Foley, for moderating the Q&A and the wonderful questions. And thank you, Dr. Pernell, for your special greetings. And to all our guests, please remember to take the survey at the end to let us know how you enjoyed our lecture today. Thank you.